Strokes represent a critical medical emergency, being a leading cause of disability and mortality worldwide. They are broadly categorized into ischemic and hemorrhagic types, each with distinct pathophysiologies, clinical presentations, diagnostic approaches, and management strategies. This video aims to provide an in-depth understanding of these two stroke subtypes to support effective diagnosis and treatment by healthcare professionals. An ischemic stroke occurs due to an obstruction of cerebral blood flow, leading to ischemia and infarction. A thrombotic stroke is when there is a formation of a blood clot within a cerebral artery, often associated with atherosclerosis. An embolic stroke occurs when there is dislodgement of a thrombus or embolus, commonly originating from the heart or a proximal artery, leading to cerebral artery occlusion. People with atrial fibrillation are more at risk for this type of stroke. This interruption in blood supply results in neuronal injury through a cascade involving energy failure, excitotoxicity, oxidative stress, and inflammation. Energy failure in the brain occurs when there is a disruption in the supply of oxygen and glucose, which are essential for ATP production through aerobic metabolism. In ischemic stroke, the blockage of blood flow halts oxygen delivery, leading to a depletion of ATP. This energy deficit impairs ion pumps, causing neuronal depolarization, cellular swelling, and eventually, cell death. Excitotoxicity is the pathological process by which excessive activation of glutamate receptors, particularly NMDA receptors, leads to neuronal damage. Under ischemic conditions, impaired ATP production disrupts ion homeostasis, causing the release of glutamate into the synaptic cleft. Excessive glutamate overstimulates receptors, allowing an influx of calcium ions into neurons. Elevated intracellular calcium triggers enzymes that degrade cellular structures, leading to apoptosis or necrosis. Oxidative stress occurs when the production of reactive oxygen species surpasses the brain's antioxidant defenses. In ischemia-reperfusion injury, the reintroduction of oxygen amplifies ROS production via mitochondrial dysfunction and enzymatic reactions. ROS damage cellular components, including lipids, proteins, and DNA, exacerbating neuronal injury and promoting cell death. Inflammation in the context of stroke involves the activation of microglia, astrocytes, and the recruitment of peripheral immune cells. Cytokines and chemokines, released in response to ischemic injury, amplify the inflammatory response. While some inflammation aids in debris clearance and tissue repair, excessive or prolonged inflammation can exacerbate secondary injury through mechanisms such as the breakdown of the blood-brain barrier and further ROS generation. Now let's discuss hemorrhagic strokes. Hemorrhagic strokes are caused by the rupture of a blood vessel within the brain, resulting in localized or diffuse bleeding and subsequent tissue damage. Types include intracerebral hemorrhage, which is bleeding directly into the brain parenchyma, often linked to hypertension, amyloid angiopathy, or anticoagulant use. Subarachnoid hemorrhage is bleeding into the subarachnoid space, frequently caused by ruptured aneurysms or arteriovenous malformations. The mass effect of the hematoma, along with increased intracranial pressure and secondary ischemic injury, contributes to neuronal damage. Ischemic strokes account for approximately 87% of all strokes, making them far more common than hemorrhagic strokes. Hemorrhagic strokes, though less prevalent, are associated with higher morbidity and mortality rates. Both types of stroke may present with sudden onset neurological deficits, including weakness or numbness, typically unilateral, speech disturbances, dysarthria or aphasia, vision changes, difficulty walking, or loss of coordination. With ischemic strokes, symptoms may progress over minutes to hours. Focal deficits without signs of increased ICP are typical. With hemorrhagic strokes, symptoms are often acute and severe, potentially including headache, nausea, vomiting, altered consciousness, and signs of increased ICP. Key considerations for health professionals are time is brain. Rapid identification and treatment are critical for both types of strokes. Differentiate early. Accurate imaging is essential to guide treatment. Tailor therapy. Management strategies must be adapted to the specific stroke type and individual patient factors. Prevent recurrence. Address modifiable risk factors, including hypertension, diabetes, and smoking. By understanding the nuanced differences between ischemic and hemorrhagic strokes, health professionals can optimize outcomes for their patients and reduce the global burden of this debilitating condition.